Hi everyone, my name is Sarah. I'm a speech and language therapist working for Doncaster and Bassetlaw Teaching Hospitals. And I'm just going to be presenting on rehabilitation that I've been carrying out with people with communication difficulties post-stroke. So first of all, I just thought I'd go through the assessments and carrying out kind of assessments with people with communication difficulties via telehealth. So I've been doing a lot of informal assessments over telehealth rather than the formal assessments. So the informal assessments, I'm doing a lot of kind of reading comprehension, spelling and auditory comprehension. There is the option obviously to do the formal assessments, and how I have been carrying out when I've wanted to do the formal assessments is either holding the stimuli up to the screen and the patient can either point to it, or if you have a caregiver as well, that's quite helpful. They can tell you what the patient is pointing to, or else you can kind of post out the assessment. And again, you can do the assessment over telehealth, but again, you might need a caregiver there just to support you with the assessment and tell you what the patient is pointing to. I've been carrying out kind of more formal assessments for higher level difficulty. So things like the Mount Wilga has been working really, really well via telehealth. So then I'm just going to go through different interventions that I've been doing. So first of all, just looking at expression. So firstly, for people with aphasia, so telehealth is working really, really well, doing things like naming pictures or objects and using the cueing hierarchy. Things like repetition is working really well. So I work in a hospital as well, but we obviously have the face masks, and that's really challenging with the face mask, whereas via telehealth, they can clearly see what you're doing, which is really helpful for people, especially with apraxia. And we're practicing reading aloud via telehealth as well. Then lots of things like picture description, again, just holding up the stimuli, describing a sequence. Semantic feature analysis works really, really well. Then lots of kind of things like naming from description, verbal fluency, and for those people with word finding difficulties. And then just thinking about dysarthria. So again, using dysarthria strategies via telehealth, practicing repetition, reading aloud, conversation. I've been doing articulation therapy as well via telehealth. Again, really helpful that they can actually see your face rather than the mask. And then dysarthria therapy on the phone as well. So it's actually really functional therapy that you get to do via telehealth. It just kind of changes things up a little bit. And then just thinking about therapy ideas for people with comprehension difficulties. So again, it's been working really well, kind of carrying out comprehension therapy for maybe kind of 2 keyword level and on. So I've been asking kind of lots of yes, no questions for kind of 2 to 4 keyword level. So kind of basic questions or semantic questions. And then obviously working on comprehension as well at paragraph level and just asking people questions on that. And then functional comprehension tasks, things like leaving people voicemails and seeing how they got on with that. It's just working really, really well, kind of going down that functional route as well. It has been challenging carrying out comprehension therapy with people with 1 keyword level. And I kind of haven't done a huge amount of that because it has been a bit too difficult. I have tried it with the support of the caregiver there as well, but I think possibly face-to-face sessions work that little bit better if people's comprehension is kind of at 1 keyword level or below. But then I've been carrying out lots of reading and writing therapy as well, so lots of functional writing and actually emailing as well. So rather than even having a video session, some of my sessions have just been over email, and we're practicing emailing and targeting the spelling kind of via that route, which is fantastic. It is a bit more difficult if people are unable to write at all, or if they're unable to write to dictation. But obviously, if you have a caregiver beside the person, they can facilitate the session, which really, really helps. And then also kind of reading comprehension, targeting 1 to 4 keyword level is fantastic over telehealth. It's a bit more difficult when you're working at paragraph level, but you can share the screen, so they are able to read a paragraph. Or the main thing that I've been doing is posting out paragraphs, and then we're practicing working through it together in the session. It's also working really, really well for people on the ESD pathway. So we're doing things like discussing what to do in emergency situations. Obviously haven't been able to practice kind of dialing things like 999 or family numbers so that people can communicate in an emergency, but family members have supported with those types of goals. Providing education again via telehealth is working really, really well, because often you have the patient and kind of family members around as well. So you actually get to educate the patient and the family together, which is fantastic. Also do a lot of supported conversation via telehealth, so you can still encourage lots of circumlocution, encourage the patient to gesture, draw, write, make choices, and then also kind of able to discuss patients' feelings as well via telehealth. So some people, when they have more severe difficulties, I've been posting them out pictures or showing pictures on the screen, and they're still kind of clearly able to kind of indicate how they are feeling. But again, sometimes you still need that support of the caregiver. So I was just going to go quickly through some case studies of people that I have been working with. So first of all, I've got Jim. So he's got quite severe apraxia of speech. He can repeat words, but he doesn't use any speech functionally. So our goal initially in our telehealth sessions was to use functional phrases or words to communicate his needs. So we were doing the 8-step continuum approach for that. And then I was also doing some picture naming for the nouns in the functional phrases. Unfortunately, there was really limited improvement in the therapy sessions, and we carried out quite a lot of therapy. So then I decided I needed to explore his feelings around his speech and his use of alternative means of communication. We had introduced alternative means of communication when he was an inpatient in hospital, and he just didn't like it. So I really wanted to explore how he was feeling around that now. So what I did was I posted him lots of resources so that we could have that chat over telehealth. So kind of, as you can see here, different rating scales, pictures of feelings. I kind of used a talking mats approach as well, just to see what his views would be around using different means of communication, things like gesture, drawing, pictures, objects. And that really gave me a clear idea about how he was feeling. So then from that discussion, our next goal was to use a pictorial communication book to communicate his needs. And again, we created that book together. I developed it, and then I emailed that out to his wife, who printed it off. And then our therapy sessions at the moment is we're practicing using that book in conversation. He's doing fantastic kind of doing it with me. So he's kind of answering lots of questions that I'm asking, and he's using it with his wife as well. So our next goal will now just to be building confidence to use that communication book with other family members. So then the next patient is Paul. He has moderate expressive and receptive aphasia. So the goals kind of that we set with Paul was to target his comprehension at 3 keyword level. And again, I was asking kind of lots of yes/no questions at 3 keyword level, things like, is a sandwich thinner than a cracker? I'd also kind of read him a story at 3 keyword level and ask him questions, and he progressed really, really well with that and achieved that goal. Also provided a lot of education to him and his family around aphasia and around how to get his message across. So we discussed that over the video calls. I'd kind of post out lots of information as well. I also phoned his wife and had a chat with her of things that she can do to support him to get his message across. And then also kind of posted, I have had a stroke card, just so again, people kind of know how to support him when he was out and about. We also kind of wanted to work on his word finding difficulties. So our other goal was to use word finding strategies in conversation with family. So we did lots of semantic feature analysis. We practiced using circumlocution. We discussed the impact of the environment and time. And again, with this, he achieved that goal and is using the strategies now independently in conversation, which is fantastic. And then the final goal was to reduce his word finding difficulties in conversation. And we did lots of things like naming from description, verbal fluency, describe similarities and differences. And again, now he conveys his message really clearly with less word finding difficulties, which is fantastic. So then I just thought I'd go through Bill as well. He's got moderate spastic dysarthria. So I had one session with him via video call on his son's phone, but all the rest of the sessions have been on his telephone because his phone doesn't actually support video. But it's working actually really, really well over the telephone. He's really getting to practice using his dysarthria strategies, which are fantastic. We're still managing to do articulation therapy for those sounds that are a bit trickier for him. And he's fantastic. He kind of sits in front of the mirror at home and he kind of is looking at how all the muscles are working. And then we're still very much doing functional therapy as well, practicing kind of using those dysarthria strategies on the phone. And then the final patient that I was going to talk about is Don. So he has mild word finding difficulties, but he was not fussed by these. He was using the strategies fantastically. But he had quite significant dysgraphia, and he really wanted to be able to write a birthday card to his wife particularly, but then to his children as well. So this was our biggest goal. So first of all, we needed to just sit down and alter his expectations. He really wanted to write quite an elaborate card. So we sat down and just agreed, let's just practice happy birthday, love from Don. So kind of his son did assist during the session. So we practiced kind of copying, writing the full words, then filling in missing letters, and then writing to dictation. So we kind of very much followed that hierarchy. And he can now write a basic birthday card, and he was so pleased that he could write it to his wife. So that's everything. I hope that was helpful. Thank you.